Hi everybody, this is Ryan, the physiotherapist at Integral Performance Physio, and we wanted to first thank you guys for asking the three interesting questions. This week we're discussing about smartphone use and potential effects on neck pain. So the first question that we received is about any stretches that we would recommend if we don't have a choice and we have to spend our time on the phone. So there's people's work who they have to spend on the phone, so they might spend it with their neck in this position. And the question is regarding any particular treatment or any particular stretches that can be beneficial. So since we're spending a lot of time with our neck bent forward, these neck muscles are going to be strained. And the reason for that is our neck is actually quite heavy. So when we spend a lot of time with our neck bent forward, these erector cervical muscles actually have to hold our head up. Now, the greater the angle that our head is bent, the greater the load is actually going to be on our back. Now, we can imagine, let's say when we're cooking or when we're brushing our teeth, if we spend our time bent forward like this, and we spend 20 minutes like this, our lower backs are going to actually be quite sore. So the same applies to the neck. Now, in terms of stretches that you can do, one very recommended stretch is the chin tuck. Now, the chin tuck is pretty much helping to reverse the effects of having our neck bent forward by reversing it towards extension, okay? So I'll show you from the side. So to do the chin tuck, normally, let's say we're slouched, we're doing our computer work in this position, the chin tuck is going to be to straighten up and then push our chin backwards. Some people will refer to it as the double chin position because when you do this, sometimes you'll get some extra folds here. So from this position, you pull back your chin and then you relax. You're going to feel a light tensing of the neck muscles, and that's normal, but you don't want to overdo it. You don't want to pull all the way back like this, and you see how your voice will ends up changing, so that means you're contracting far too much. So you chin tuck, and you relax, chin tuck, you relax. You're going to feel some light stretching. So this you can do about 10-15 times, and you can also hold this position. Let's say when you're driving, or let's say you spend time on your phone and after a while you feel some soreness, what would be good is to start doing some chin tucks like this. Just hold the position and you'll feel the stretch. Another exercise that can be beneficial is the stretching of the upper fibers of the trap and the levator scapulae. So these two muscles are located here, and they get tense quite often since we're in this position and we're constantly contracting this muscle. So how to stretch it would be, let's say the left side is tight. We're going to have our left hand behind our back, and you're almost like reaching for your right back pocket. So that helps depress the shoulder. Then you're going to bend your head forward. You're going to bend it to the right side. Already there, you should feel a light pull. Then with your hand, you're going to pull your head towards your right foot. This way, you're going to feel a gentle stretch right here, and you hold this for 30 seconds. This you're going to repeat many times throughout the day whenever you feel tense. Now, the third exercise we would recommend is the massage ball. So we already have a video about massage ball rolling, and we recommend this over using the foam roller. Since the foam roller is actually quite large, it's hard to get working on the neck muscles since it uses your body weight, and then the neck is not actually very heavy. So with the massage balls, they're designed so that there's a ball on each side, and that way it puts direct pressure on exactly where the muscles are on the neck that are bothering you. So the massage ball could be another way to work on the exercises. So a second question we received was, I was curious to know if there are any sleeping positions that can cause neck problems, or if there's any that can help with the pain. So that's actually a question received very often. What is the best sleeping position? What are the best pillows? What are the best type of mattresses? And there isn't a one size fits all kind of answer. Now, regarding sleeping positions, universally, I would say sleeping on your stomach is not good. And the only reason why we would say that is because when you're sleeping on your stomach, you have to have your head rotated to a side. You might have your arms up like this, and in this position, since you're spending the whole night with your neck rotated, it is going to have effects on the neck musculature. One side, let's say the left side, is going to be shortened for the whole night, and the right side is going to be lengthened for the whole night. That in the long term might not be great for you. However, I have met patients that have slept on their stomach their entire life, and for them that might be okay. That's why I say it's on a pretty much a case-by-case basis, but in general I would say try to avoid sleeping on your stomach. So that would be a position that can potentially cause neck pain. Otherwise, for the general population, I would say it's the pillow that actually matters a lot. Now, is it worth paying $150 for a pillow, or is it going to be better than, let's say, a $15 pillow from IKEA? So, me personally, my pillow is about $10-15 from IKEA, and for me, it works perfectly. The main thing that you want to have to look at is the thickness of the pillow. So you don't want your pillow too thick. So let's say this is me lying on my back. If the pillow is too thick, then your head is going to be too far bent forward like this. If it's too thin, then when you're lying on your back, your neck is going to arch backward like that. That's not good. So the key thing is to find a position where your neck can be neutral. So if you've seen our blogs about back position and neck position to avoid pain, then you'll notice that you want your ear to be in line with your shoulder. So you can always get your partner to look at you when you're lying on the pillow and see, where is your ear position? Is your ear in front, in back, or is it pretty aligned? The key thing is to find a pillow that helps you be aligned. Now for everybody, for each person, it's going to be different. Some people, their backs are a little bit more rounded, or their torso is a little bit thicker, and that's going to affect it, because if your back is more rounded, well, then there's going to be more space behind your head, which means you need a thicker pillow. But the key thing is to test out different pillows, and test out different thicknesses, and then get a friend or a partner to take a look at your neck position when you're doing that. The last question that we had was, I also wanted to know if spending too much time on our cell phones can cause long-term damage to our neck and spine. So since in this day and age, most people spend a lot of time on their cell phones, it's a very appropriate question. There's no straightforward answer to this, and we'll try to keep it as brief as possible. But I would say it can have permanent long-term damage if you are negligent and you continue doing it regardless of the pain. So our body is smart. Whenever we're doing something that's not good for the body, our body will send a warning signal, which is pain. And when you receive this warning signal, your body is pretty much telling you, get out of this position, do something else that will avoid overexerting this area. So in general, I would say if you are aware of your body and you follow our advice, the stretches, the postural tips, then it should not have long-term damage. However, if you don't do your exercise, don't do any stretches, and you spend all day like this on your phone, and then all day on the laptop like this, and then you sit on the couch all day like this watching Netflix, then there's going to be a significant amount of wear and tear that over time will build up. Our body is very intelligent. It will always try to heal the damage, but if you don't allow your body to rest and give it that opportunity to heal, then that damage actually accumulates, and that tension builds up more and more tension, and then it eventually develops into weakness, which then can cause more permanent long-term damage. So the general answer is yes, it can, but if you follow our recommendations and exercises, which will be the next video that we're going to post, will be some recommendations of stretches and of exercises that can help. So if you follow that advice, then there should not be any long-term damage. So we wanted to thank our patients for asking these questions, and we really enjoy the fact that our patients will get involved, and if you have any questions, please let us know. Our objective here is to help inform as much as possible the population so that we can avoid these type of injuries, and these are very avoidable injuries with just some knowledge and some corrective exercises, it can make a big difference so that you can live pain-free. So thank you once again, and until the next video.